This treatment. Okay, come talk to me real quick. Hi guys, it's Dr. Emer, West Hollywood. You know, you've been following us, and I did laser fellowship, so we do a lot of tattoo removal. I'm very happy to have a patient of mine who flew in very far because she has tattooed eyebrows. If you take a look here, it's just very dark pigment. I've already done one side of it, and you can see that frost there. That's an amazing reaction. That means she's going to respond very well. We're using a YAG laser right now because she's super light skinned. I don't want to use a ruby and leave what's called a ghosting effect. We want to use the YAG to get a little bit deeper. But what we're going to do is we're actually going to treat it once and then put a chemical on there. Can you grab the patch for me? Called perfluorodecalin that we did a lot of research on. There was a bunch of stuff done 10, 15 years ago when I was in my training. People were doing just one pass and coming in every 4 to 6 weeks, sometimes up to 8 weeks. Then people developed what's called the R20 method, where you could wait 20 minutes to do the next treatment because you had to wait for these gases to disperse. But watch this, if you put this chemical right on here, look it, you'll see even within a few seconds, the gases start to disperse. So we're gonna let that sit a minute, okay? So that I can do a few treatments on her because she's traveling from so far. So I'm gonna have you stand back just a teeny bit, okay? We're gonna turn the laser on, and I just don't wanna risk her. Now, there is risk with doing tattoo over brows, you guys, and the risk is, sorry honey, is damage to the hair, but not permanently, just short-term. And then also, turn to the right a little bit, any scarring or pigmentation issues, but she's totally fine. She's very light skin toned. So now you can see this is an amazing response. What we're gonna tell her to do is, now we're gonna go to the second side. So I'm gonna put a little bit of the chemical on the second side now. We're gonna have her do very extreme at-home skincare. Very important to use growth factors, Silicon, which is a silicone gel, and BioShield, which is a protective barrier post-treatment. But now you can see a lot of the foaming has gone down, so we're gonna take the patch, we're gonna go right on top. This is a silicone sheet with perfluorodecalin in between, and then obviously we put it on there as well. So we're gonna start again on the right side, bear with me. So this allows me, you see now we're getting reaction when we wouldn't have gotten reaction doing a second pass without this patch in the past. So now we're gonna put a little more chemical on there. She's doing great. Now because she's from so far, I want to give her the best treatment we can. Okay, but I'm not going to go crazy high. So far the hairs are fine. I'm not going to go crazy high with the pulsing. Can you hold the bottom of that just a little bit? Thank you. You want to get that flat, everybody. We're going to start on the other side. Good. See that little, turn to the right a little bit? You see that little crackling, everyone? That crackling means that there's pigment underneath that's breaking apart. You have to think of this as popcorn. It's just bursting the popcorn pigment. Good. All right, now we're gonna do one more pass. Hold that for a second. We're gonna do one more pass. Now she'll get a little more inflamed than when we would normally do tattoo removal, but because we're using the patch, the downtime is gonna be much less, and she's gonna get a significant much more significant improvement. Okay, hold that down. Last pass. And again, still has response. Perfect. Let's go to the other side. Just do a little bit more of the chemical. This is called the DeScribe patch. I have a bunch of YouTube videos on it, everybody. It's one, in my opinion, one of the coolest inventions ever been made, because it's all based on science, you know? It's really cool. Like, this chemical can actually cause gases to disperse and somebody get a much better treatment. It's really amazing. She is a strong woman, I will tell you that, because she's only doing this with topical, but she's on a mission. And with the mission, we gotta fix this. Turn to the right a little bit. You know, this is devastating to women that have it. So that's it. That's perfect, you guys. That's exactly how it should look. That frost, and we're gonna put some ice on there and some silicone gel. And then, how did it feel? I know it's not the best pain in the world.
It was quick. It was very quick. So it
Look at your eyes. I've done this a long time. The response is perfect. I want you to ice pack for right now. And the goal for her right now is to get as many treatments in as we can as time goes on. She lives far away. So we'll follow her and we'll see. But even if she waits 6 to 8 months or 6 to 8 weeks and waits on a kind of few months to do it, she's gonna get improvement in the tattoo pigment over time. The body comes in and starts to break it apart, and it does that over weeks to months. So even one treatment can last like 6 months in improvement in tattoo removal. So she's going to get improvement. In the meantime, I've been having her use Latisse actually on her brows so that we can grow whatever hair she does have there, and use growth factors on there to help her heal and keep the hair strong. And then we'll go from there. That's it. Tattoo removal, first one, done.
Good job.
Congrats.